Okay, without further ado, we will start our webinar. Thank you everybody for attending. Today's topic, we will look at the slideshow. It is called Cover California COVID-19 Assistance, Subsidized Coverage, and Open Enrollment. 加州全保 COVID-19 的援助、补助和申请开放期. So thank you everybody for attending. We will mostly be talking about everything in English. If you have questions, you are welcome to send us a chat or email us or follow us on social media. And definitely we will try our best to answer you. So with that said, let's go to the next slide. This is the flyer you probably saw on social media, talking about our topic this time. We're going to be talking about changes of health insurance during COVID-19, the importance of having health insurance during these difficult times, subsidizes, changes in Cover California, open enrollment, and obviously we have our raffle every time, so hopefully you guys will stick around for the raffle. And we have 2 locations servicing you at this moment. We need prior calls, appointments before you guys arrive. So we have one in the City of Industry, and we also have Brea location. So you guys are welcome to set up an appointment with us, and we are here to serve. Next page. This is our Chinese version. 在健康保险发生了在 COVID-19 什么样的变化，然后呢我们还有就是在现在的时期呢买保险需要注意一些什么事情，以及我们现在的就是我们的补贴的范围是不是有一些改变。那今天这个疫情当中呢我们保费是不是会改变，然后是不是有更多的补助等等的。那今天我们的开放期是不是也有改变，所以我们今天会深入的探讨。好，in English， 我用英文来跟大家分享，所以是原文的一个 webinar。那如果说需要翻译的话呢，我们是希望说你可以跟我们公司联络。Okay, next. Okay, so before we start, we just want to talk about our monthly raffle. Obviously, everyone who joined today will be able to join our raffle, and or you can have your friends, if they didn't join the raffle or join the webinar, you can take a screenshot of our social media QR codes. 二维码我们在最后呢会提供二维码，所以你可以截图跟你的朋友分享，然后他们就可以参与我们的每个月的 raffle 抽奖。那今天如果说你有参加我们的 webinar 的话，你也是自动加入这个额外的一个抽奖的活动，除了今天之外呢，还有每个月的一次抽奖。So this raffle is in addition to what you will be participating at the end of the session today. So we're just here to give out prizes everywhere. So thank you for attending, and next page. So our raffle gift card is $25. We will have that at the end of the session for everybody. Okay, so for introduction, I'm going to talk a little bit about the background of Cover California. So California is actually at the forefront of the healthcare reform. So we are actually doing pretty well in terms of our whole system. We have a platform providing insurance with subsidized coverage. So there's actually an increase of enrollment during, throughout this whole time that Cover California has been in place. So in 2019, because there is a, we're really strict on the penalty, we actually got less premium increases because we actually got more people enrolling, and we also actually got money from the penalties. So where premiums are not going to increase so much for 2021. And also we want to talk about a little bit about the why the increases. There are not that many increases even though there's COVID-19. So even though the treatment of COVID-19 has increased in cost because more people are getting sick through COVID-19 and it's a new disease. However, because of telehealth, we have Teladoc, and we also have, other telehealth service providers. And there's also an extended grace period, and more people staying home, not going to the doctors, actually balance out the increase of charges for COVID-19 treatments. So overall, there's actually, expected progression of the insurance industry. So a lot of people are like, oh, more people are using the insurance for COVID-19. There must be a huge premium increase. However, through the California platform, that is not going to happen. So our increases are going to be really small this year. So that's actually a good news for everybody. We are forecasting 0.6% increase in terms of the premium, followed by what we had back in 2020, a 0.8 increase from 2019. So with that introduction, I want to get into our class portion, and so we can get to the Q&A, the raffle, and the survey at the end. So let's get to the next slide. Okay, so what changed about health insurance? So in 2019, we actually got away with no tax penalties at the very end, at the tax year. However, in 2020, it came back. So the 2020 penalty was $695 per person, or $2,085 per family. So 2021 is going to be a little bit higher. So we're going to talk about it in the next slide. But Cover California offers coverage for immigrants and under specific situations, as well as citizens and permanent residents. Next. So like I said, in 2021, the penalty is a little bit higher than before. It used to be $695, but now it's going to be $750 per adult and $375 per underage dependent, under 18, when you file for your tax return in 2021. So a family of 4 that goes uninsured for the whole year will face up a penalty of at least $22.50. So that went up from the $20.85 I was talking about for 2020. So 2021, we're going to have a higher penalty, but just by a little bit. Next. So importance of having health insurance. So maybe many people know that medical costs could bankrupt a family. So it is very important to have health insurance, even though you pay a premium monthly. But with the Cover California subsidized system, you actually don't have to pay the full amount most of the time. So having insurance is actually good for medical assistance. You don't have to feel scared that you're out of insurance, you cannot get care during that time. So there's also more security in your financial planning. So you're not going to be investing in a bunch of things such as your house, maybe 401k, retirement plans, but all of a sudden you get sick and you have to pay, take money out to pay for the medical expenses. So having health insurance, you actually have a cap to that portion of the cost. So, and also, like I said, there'll be a penalty, so it will be mandatory for you to have insurance. So in a way that is good, it forces you to be diligent, be responsible for your own well-being. So next page. All right, so subsidized coverage. So most people that enroll in Cover California, with a study that said most people who are in California, about 88%, have subsidized coverage. So if you are in Cover California, most likely you will have some kind of subsidy to your premium, or even to your benefits, or even to your copays, depending on your income, your region, and your age. So it lowers mostly your monthly premium, which could be a big chunk of portion, and which is the amount you pay for health insurance coverage every month. So a lot of people don't know the terms. So today I'm going to basically go through some of the terms that people should be familiar with. So premium is the monthly fee that you pay into the insurance to maintain your insurance coverage. Next. Okay. So premium assistance is a tax credit. So it's formally called the Advanced Premium Tax Credit, APTC, to reduce a person's monthly premium costs. So from the last slide, you know that the premium is a monthly fee that you pay. However, if you qualify, like I said, your age, your income, and your region, you would qualify for some kind of subsidy, which means that part you don't have to pay. The government pays you to subsidize your premium. So let's say your premium is $800, but due to your lower income, the government says, okay, we're going to pay partially your premium. So you end up paying a lower premium, such as $100 or $200. So you get a discount for your premium. So the next bullet point is cost sharing or reductions. So they are subsidized to reduce individuals' out-of-pocket costs. So such as your co-pays, your co-insurance, deductible, and out-of-pocket maximum. So to learn these terms, what is a co-pay? What is a co-insurance, deductible, and out-of-pocket maximum? You are welcome to go to our YouTube site, which I have 1-minute videos talking about each term. So I know that people need a refresher on all these terms. So that's why we permanently put videos on our YouTube channel, so which we will be sharing at the very end. So you can learn about copays, all that good stuff. It also has Chinese captions. 所以呢，今天我讲的东西，这 copay co-insurance， 如果说今天不了解是什么的话呢，我们在我们的 YouTube 的这个频道上面也是有这些中文的翻译，所以欢迎你们就是到我们的 YouTube 的频道去学习这部分。So thank you for letting me switch to Chinese. So now we are going to be going to the next page. Okay. So what is Cover California Assistance? Cover California uses a federal poverty level, which is called the FPL. It's a chart that is on the Cover California website, and every year is a little bit different. So for one person in the very beginning of Cover California, when it first started, one person's income has to be more than $16,000 in order to get some kind of subsidy. If you're lower than that number, then you will fall into the Medi-Cal portion. But as of last year, that number went up to close to $18,000 of annual income. So it adjusts based on inflation, based on the current situation of our government and our society. So we are going to go into more detail later on in our presentation to talk about the FPL. So it determines eligibility for financial help and programs such as Medi-Cal. So exactly like what I said, there's a threshold. If you're below that, you're Medi-Cal. If you're more than that, then you will have to be on a sliding scale to see how much premium subsidy you will get. So these levels set each year by the federal government take into account the individual's annual household income and household size. So that's pretty self-explanatory, which we'll get into more detail in the next slides. Okay, so we're talking about exceptions to the employer-sponsored coverage affordability rule. So most individuals and families are offered insurance at work or through a family member's job, do not qualify for a tax credit through Cover California. So why is that? I want to go into a little bit in detail that because you're being offered a coverage through your work, Cover California, the government doesn't want you to also get let's say free insurance, because they, at this point, before the end of the year, they wouldn't know if you're paying for the insurance or the company is paying for the full amount. So let's say you're offering insurance, but you also feel like, hey, with my income, I might be able to get a tax credit to Cover California. So a person could be having, double insurance or double dipping, or, situations that the government cannot control. So what the government is doing is that if your employer is offering coverage to the full-time employees, and it falls into the the level that is affordable to you, then you will not be able to apply for subsidy in Cover California. So this situation is individualized. So if you have any questions on that, let's say you are employed, but you don't want to take your employer's insurance, you are welcome to contact us and we can talk about it in detail. So like I said, I'm going to read the second paragraph. If the health plan offer at work doesn't pass an employer-sponsored affordability test, then you may qualify for a subsidy through Cover California. So everyone's situation is different. So I encourage highly that you talk to your insurance agent or you can talk to us. Next. Okay, so how to qualify for Cover California as an immigrant. So a lot of people have different immigration status. So I'm going to go through a few, but obviously everyone might have different statuses. And so like I said, you're welcome to talk to your broker or you can talk to us more in detail. So we are actually required U.S. citizens, U.S. nationals, and permanent residents to have health insurance that meets the minimum requirements. And also, if you're lawfully present in the United States, and most likely if you do report taxes, you don't want a tax penalty. So if you do qualify and you report taxes, we highly recommend that you get insurance coverage. So it could be green card holders, refugees, and asylees, humanitarian immigrants, non-immigrants, worker, and student visas. So please talk to your broker or you can talk to us. Next. Okay, so how to qualify for Cover California as an immigrant? Those who are undocumented have two options. You can see if you're eligible for free or low cost of Medi-Cal. So Medi-Cal is outside of Cover California. So you could use the Cover California website to determine if you qualify for Medi-Cal. But at this moment, only Medi-Cal will be able to solve your coverage issues if you're undocumented. So second bullet point is you can purchase a health plan privately by enrolling through an insurance agency like Health of California Insurance Center. So that is a independent agency and we recommend that you contact them directly. Next. Okay, so this is the FPL chart I was talking about. So I want to go into a little bit more detail. So without me, you are able to go online and see it yourself. If your screen is, if my screen is blocking, you can like move my screen or something, but make sure you see the whole thing. So there's yellow, there's blue, there's purple. I just want to talk about from top to bottom, from the left to right. So we can do that for now. So the California state subsidy starts at 138%. I don't know why there's a little like white block, but yeah, so basically you are able to get subsidized if you are above 138% in terms of your annual gross income. So the FPL percentage is based on how much you make. So the federal tax credit actually starts at your income being 100% at the poverty level, all the way up to more than all the way up to 400%. Okay, so if you're American Indian, Alaskan Native, it's a little bit different. So we're going to talk about that specifically. If you are, you can contact us. But for right now, our session, I'm not going to go into details on that. So you guys also see Silver 94, Silver 87, Silver 73. They actually are basically subsidizing your benefits. So if your income falls between 138% all the way to 250% of the federal poverty level, then your benefits will actually be subsidized. So let's say, for example, a silver plan copay usually is, let's say, $40 per each visit. But if you do have a silver 94 plan, which you would qualify based on your income, then your copay will be, let's say, as low as $10. So not only your premium is being subsidized, your benefits are being subsidized also. So it has a little bit, 100% to 50%, 150% to 200% for the silver 87. We also have the 200% to 250% for the silver 73. So what does that mean? So it means that your out-of-pocket cost, if you have a silver 94, your out-of-pocket cost will be covered at 100 to 150%. So it's actually a super rich plan. And if your income does qualify, let's say you're one person making about $19,000, then you might consult your broker to see if your benefits would be covered also, if you could be upgraded to a silver 94 based on your income, based on the changes of your income. A lot of people have different incomes this year due to COVID-19. So it's definitely a good time for everyone to talk to your brokers and figure out how you're going to go forward for the year of 2021. So with one person, if you do want to qualify for federal tax credit, you want to make sure that your income is, between the 100% to the 138%, all the way to 400%. So based on actual practice, we would recommend for if you're one person, you would be making around 18,000. That actually falls into the lowest subsidized category. So if you're making less than 18,000, then you most likely will be going into Medi-Cal. So that's actually through an actual practice. This chart is only for reference, and also it might be a little bit different in 2021 based on the final decisions. Because we're still in September, we just want to make sure that we do show you guys a chart so you have it for reference. This is actually on the Cover California website, and but for the final chart, you want to see what they come out with at like a little bit later during the year. So the purple part actually has Medi-Cal for adults, Medi-Cal for pregnant women, access program. That part you might want to consult your local county medical office, Medi-Cal office, because every county might be a little bit different, and most insurance brokers, if they're in, they might not be able to assist you with the, Medi-Cals in detail. So you also see on the dark blue portion, it says Medi-Cal for kids, 0 to 18 years. So if you're a family of 4, so we're gonna go to a family of 4 portion. You go down on the columns, on the first column, you go to 1, 2, 3, 4, and then you go into, let's say, your FPL at 266%. So a family of 4 making 69,692, the adults might have a subsidy to their regular health insurance. However, the kids might fall into Medi-Cal due to the actual income of 69,692 being inside the Medi-Cal for kids, the dark blue portion. So you might have combo plans. So the adults might be, having, let's say, Anthem Blue Cross for the adults, but the kids, they will have a Medi-Cal program based on the county. So it is very important to double check your income, your annual gross income, which is the last number on your 1040, the line 37. That'll be the number that determines your actual income to be considered for the FPL percentage. So let's say the same family, they are making, the 4 people family, they're making 77,250. Based on this chart, they'll be making 300%. So which you will go under this chart and look at the family 4 under 300%. Then let's say the adults want to enroll in Anthem Blue Cross. Then because the kids are not within that dark blue portion, the kids will have the option to enroll in Anthem Blue Cross also. However, because the income is a little bit higher, the subsidy, premium subsidy for the whole family might be a little bit less because they are making more. And like I said before, it's a sliding scale. So if you're making more, you get less subsidy. You're making less, you get more subsidy. So each family is different, and we recommend that you guys contact your brokers, or you can contact us. Next. So this is more in detail what Medi-Cal does. We highly recommend you contact your local Medi-Cal office after you try to enroll on Cover California. If they say, hey, you qualify for Medi-Cal, then that's the time when we call the Medi-Cal office to figure out more details. So Medi-Cal for adults, up to 138% FPL, which is shown on the chart prior, that if you're making less than 138% on the FPL, you'll be automatically considered for Medi-Cal. Also, Medi-Cal for children. Like I said, that was a dark blue area. If your family is making less than 266%, then this child will be sent into Medi-Cal. Pregnant women, different MCAP, C-CHIP, a little bit different. So please consider, this chart for your own reference. Next page. Okay. So for the Cover California programs, this is more like a summary of what I just showed you. So California state subsidy, 0% to 138% FPL is over 200% to 600%. Federal tax credit, 100% to 400. Enhanced silver plans, 100% to 250, all the way to over 200% to 250 FPL for the silver 73. So there's a lot of percentages being thrown around. So I highly recommend to just kind of use this as reference. What actually matters is when you go into your broker's office or talk to your broker to get a quote based on your actual situation. So your quote will let you know the actual dollar amount of what you qualify for. So the example that I gave for the one person, if your annual income, adjusted gross income, is around 18,000 to 19,000, then you most likely will fall into a silver 94 or 87 situation, which means your premium is subsidized. Let's say you're a young person, your regular premium is probably 200 or 300 for the silver. But with the income, you're able to get your premium down to, let's say, within 200 or 100 something. And your benefits will be richer. Instead of paying $40 for copay, you might have to pay only $10 to $15 for copay. So definitely have the most accurate income information. You can provide your tax return. You can have your payroll information and or other types of income proof in order to help your enroller help you to get the best plans. Next. Okay, so a lot of people are interested to know about open enrollment. So we've been open enrollment, ING, like we're in open enrollment the whole year in 2020 because of COVID-19. There's a lot of special openings. We extended that many times. The regular time to end the open enrollment was supposed to be January, but we kept on extending the open enrollment, special enrollment, just so people who are affected by COVID-19, or if they're currently they're recently laid off or even furloughed, maybe your employee status is uncertain, you're still able to enroll in Cover California. So at this moment, regular special enrollment has been closed, but our regular open enrollment is coming up. So you'll be able to enroll in Medi-Cal or Cover California. The new law requirement is that all California residents is to have health insurance or pay a penalty. So next. Okay, so we're going to share with you a little bit about the open enrollment dates. They might change, they might extend it. We will be able to find out a little bit later. if, let's say in January, if we're going to have more extensions. So Thursday, November 1st, 2020 is our first day of open enrollment. And let me put my chart. Okay, and Saturday, December 15th is actually the end of open enrollment, but usually it gets extended. So let's say if they extended this year, Wednesday, January 1st, 2021 is the earliest a plan can start. So how is that being explained? So usually if you want to enroll in a plan, you during the open enrollment, all you have to do is enroll before the 15th of the month. So let's say November 15th, let's say December 15th, you enroll, December 15th or 14th, your natural effective date would be January 1st. However, because it's a regular open enrollment period, if you were to enroll on November 1st, your effective date will be January 1st regardless, because it's an open enrollment situation. However, let's say if you, let's say leave an employment and you would like to enroll in the next month, then your effective date will be the first of the month after. Unless you can prove that you lost your insurance at a specific date, then sometimes we'll be able to help you have a seamless carryover to cover California to cover your insurance immediately after you lost your job. So those are special situations, but for now, the open enrollment will be starting November 1st and it will end on December 15th. But we do see a healthy extension being proposed during that time. So let's wait and see. So next page. All right, so Cover California Health Insurance Company for the 2021 plan year. So the good news is we actually, throughout California and different counties, more carriers are coming into the market. So we have more people competing for your business, and which means that, you know, that's why in the very beginning I said that the rates are not hiking up as much, because we have a competitive market. People want to, you know, make sure that everyone's enrolled. So for LA County, our options are Anthem Blue Cross. We have Blue Shield. Those are two different companies. HealthNet, Kaiser, LA Care, Molina, and Oscar Health. Next. In Orange County, we have a little bit less, but it's still a healthy amount of carriers. We have Blue Shield, HealthNet, Kaiser, Molina, and Oscar. Okay, so I just want to talk about a little bit, because we're talking about the regions. So we're looking at a chart from Cover California that the average rate change going forward in 2020, actually back in 2020, our rate change from 2019 to 2020, it had been for LA County on the northeast side, there's a decrease of 0.9%. And in the southwest side, there's actually a decrease also of 2.1% from 2019 to 2020. In Orange County, there was an increase of 0.7%. So, but what we wanted to say is that if you're very diligent about your plans and you want to maybe shop around, so by shopping around during that time, you'll be able to save up to around 15%. So definitely look at your income, look at your plan options, and just, you know, approach your broker or just go onto the website yourselves. So new changes for special enrollment. So earlier I was talking about open enrollment, that's for everybody, but if you have a special situation, you might qualify for special enrollment, which means there's more flexibility for states and essential health benefits, verification for premium tax credits, changes to rate review. So I have some notes to show you guys to help, you know, understand the situation. So what does that mean for more flexibility for states and essential health benefits? So when Obamacare first started, there's actually 10 essential benefits that each insurance plan has to have in order to qualify for a essential plan that could be offered, and that will help people not to have any tax penalties. So that is to prevent people enrolling in a hospital-only plan, which doesn't include, let's say, physical exams. It doesn't include pap smears. It doesn't include like blood tests, urine tests, and all that. So the government actually set up the actual 10 essential benefits for each carrier to follow. So when people enroll in these plans, they will not get a tax penalty. So recently, there's discussion that, based on, which side wins the election, we might have different essential health plans. That could be selective or flexible. So each insurance carrier don't have to follow such a strict guideline from the government of having only those 10 essential health plans. So let's say wellness tests, let's say free blood and urine wellness, and also free maternal tests. So those things are actually in the essential health benefits right now, and that could be switched around with like 50 other ones. So at this moment, there's talks of that. So it could be executed or be considered as qualified coverage. So that's the first bullet point. And the second bullet point is the verification for premium tax credits. So we will, the CMS, which is the entity that rules the insurance industry, it says that they're going to implement stronger checks that would take tougher measures to verify anyone applying for the tax credits to prove that income, that this is what they're earning. So the new measure is also going to disqualify any applicant who fails to file taxes or reconcile prior to APTC. So a little bit more strict going forward on verifying your income. So the last major takeaway from the new CMS rule is to changes to rate review. So under the ACA, insurance companies had to justify any premium increase of 10% or more, but that number will jump to 15%, which already did in 2019. So also the CMS final rule will get state regulators involved in the rate review process and exempt student health insurance plans from federal rate review requirements. So a lot of details going on, and we just want to make sure that people are aware. If you're interested in more information, you could actually talk to your broker, or look it up online. Next page. Okay, so special enrollment period qualifying life event coverage for wildfire victims. So many people don't know that I actually live right by the foothills. So last week, we are fortunate that our house did not get burned down, but we were able to see the fire directly from our window. So I have small kids that were looking at those fires right before bed and waking up the next morning and saying that, "Mommy, I had a dream about lava coming down the mountain," and we were crying and we were scared. So with that said, I took my whole family and we temporarily evacuated to a different city. So because of some less fortunate houses or people or residents that had to be forced evacuated due to their houses being actually burned down, there's actually a Cover California qualifying life event, QLE, for those impacted by the California wildfires. So there are wildfires up in Northern California. There was ones around Mammoth. We have the bobcat here in LA County. So because it was the state of emergency announced on August 18, the wildfire QLE began on August 18 and is scheduled to run for 60 days until October 17. So we are approaching the October. So if you are affected by the wildfire, you don't have insurance, you don't need any proof of documentation because we know where you live. And it's actually a special enrollment to entice anyone who's in that situation or affected by that situation, and to take advantage of this special enrollment period and get yourself some insurance. So yes, please contact whoever you need to get this done. So next page. Okay, so this new QLE applies to all exchange new enrollments until October 17th with a possible extension deadline depending on how long the wildfires last. So the Bobcat fire had subsided a little bit. It went north into more of the inner mountains, but there's still residents there. There's animals. There's land. So it depends on the whole situation. So there is no retroactive coverage, and but we do recommend if you do feel like you need coverage, you can take advantage of this period. Next. Okay, special enrollment period qualifying life event coverage for wildfire victims. Still, there's a little bit more information. Standard effective date rules apply and will be adjusted for applications submitted with this wildfire QLE. For example, if you submitted, let's say September 4th, because that's closest to our dates. Today is the 22nd. Your effective day will be October 1st. But if you're applying from August 27th, your effective day is October 1st. So another example, let's say you apply today, which is September 22nd. So your effective date would be November 1st, because you already passed the middle of the month for September. So for more details, please talk to somebody. So next page. Okay. So Teladoc medical and mental health consultation for $0 with Blue Shield. Blue Shield is one example. We're putting down Blue Shield because it is something that has track record. I understand that Health Net has it. Many other carriers have that too. Because of COVID-19, it has become more and more difficult to actually see your provider in person. First of all, there's a danger of contracting COVID-19. Second of all, they might be really busy seeing other clients or other patients that might have more serious disease. So due to COVID-19, Teladoc mental health visits are available to all non-grandfather PPO members for $0 copay through the remainder of 2020. I understand that with other carriers, they actually have HMO plans that are available also. So beginning January 1st, 2021, this will become a standard benefit for non-grandfather PPO plans. HMO members already enjoy this great benefit. So HMO and PPO, as long as you have insurance, you should check with your provider to see if there's actually Teladoc or any other online platform for you to see confidentially your doctor or your therapist. Next. Okay, so Teladoc medical and mental health consultation for $0. Advantages is you can get care from US board certified psychiatrists, psychologists, social workers, counselors, and therapists, and coping assistance with anxiety, which is a lot happening with everybody during this uncertain times, depression, stress, domestic abuse, which is a very important topic also because they have nowhere to run. They're actually stuck at home, probably might be with their abusers. Marriage issues, you have to see your husband and wife all the time, or your partner. How do you solve issues when they're always with you? So a lot of eating disorders, substance use disorders, grief, and more. So there's actually prescriptions that could be done over online and sent to your pharmacy directly. So next. Okay, so with that said, we're coming to the end of our session. We actually have a question right here, and we highly recommend people submit their questions here in the chat room. If you have any, we're happy to answer them. So the first question, I already have coverage with Cover California, but I'm having trouble affording my coverage because of loss of income. Am I eligible for extra financial help? So with the presentation that I just gave on FPL, that chart that where I spent a while on, it will show you what you actually qualify for. So I know you might have lost your job, or maybe like having less income during the year. What you have to do is kind of estimate what you made for the whole year, or what you will be making for the whole year, and kind of look at your deductions. But you want to find a number before taxes. So that's generally your adjusted gross income. And with that number, you can see on the left-hand side where the column says how many people are in your family. So if you're a single person looking for coverage, you want to look at your income, your estimated income, and see if you fall into Medi-Cal, or if you fall into, the 138% where you can get a lot of subsidies, or your income just in such a high bracket that you might still have to buy insurance completely out of your own pocket, which we do provide that also as for a free consultation. So definitely do some calculations, make sure that you get some kind of affordable coverage. Otherwise, you will end up with a penalty. Next. Okay, so the second question we have is Medi-Cal an option for my financial help request? So yes, definitely. If it's financially needed, as long as your adjusted gross income is under 138%, then you will qualify for Medi-Cal. So you'll be able to find out about this on the Cover California website by entering your information, or you can just contact your local Medi-Cal office directly. Another way of qualifying for Medi-Cal is extreme poverty, or if you are undocumented, or if your visa is questionable, but Medi-Cal will accept it. So any different situations that you should consult Medi-Cal directly for. Next. Okay. Number 3, I am furloughed on unpaid leave, on paid family medical leave. What are my coverage options? So as people know that even if you're furloughed at this moment, you are qualified for EDD, which is unemployment benefits due to the special situation that we have. You don't have to be offered employment upon COVID-19 ending, but furloughed, which means that if your income is at 0%, then you'll be able to qualify for full unemployment benefits. So unpaid leave meaning you don't have any pay, paid family medical leave. So definitely you want to look at your adjusted gross income and talk to a tax advisor to see what type of adjusted gross income you will have based on your current situation. And what the insurance company would need is that final number after you talk to your CPA, and we will use that number to determine your federal poverty level to see if you qualify for Medi-Cal or Cover California or just regular insurance. Next. Number 4, what will happen if I earn more during the year or less when calculating my income to receive premium assistance and cost sharing reductions? So this is a really good question. A lot of people, their incomes, their jobs change, their income change, especially during COVID-19. There's a lot of changes that people are going through. So you definitely want to see if you qualify for better, what I mean better, meaning more subsidy when your income decreased. Maybe you'll be able to get the full subsidy, like around 138%, based on your lower income. So as soon as you find out what your new income would be is the time where you contact your insurance agent. Because if you wait until the very last moment at the end of the year, let's say for the whole year, you might qualify for a really good subsidy, but you didn't take advantage of it. At the end of the year, yes, you might get some tax credit back at the end of the year. However, it might not be the full thing. It might, based on your new income. So, or vice versa. If your income was really high, really low in the beginning, and all of a sudden you got a job and your income's really high, then obviously your subsidizing situation will be different dramatically. So we highly recommend anytime you have an income inconsistencies, you let your insurance agent know right away. Hope that answers your question. So like always, we will email all attendees a copy of our PPT. Our class recording will be available on YouTube. Health coverage options and financial health flyer. And we have our ebook on healthcare costs and getting help paying for coverage. So every single class, we provide a lot of useful information. Our ebooks are referenced from reputable sources, and our health coverage options and financial health flyer. Hopefully that can help you tremendously during this uncertain times. Yes, so that's our health coverage options and financial health booklet. It'll be sent to you, or is it being shared right now? I think it'll be sent to everybody. All right, so next. Oh, we also have an ebook that says Cover California, Healthcare and Costs, Getting Help Paying for Coverage. So with that said, we're coming to the end of our webinar today. So we actually used up the full hour this time. And our October events will be, September monthly raffle. So we collect all the names in September, and we were doing the raffle on September 30th, which is the last day of September, which we counted as October 1st. And webinar, we have an October, in October at 11 a.m. So we will announce the date shortly. You're not going to miss it if you already follow us. We have it on Facebook, everywhere, Instagram, and all that. So we're going to be talking about Medicare HMO and supplement for our open enrollment for seniors. So this is very exciting. A lot of people are presenting different information. We feel like, yes, we can do it in Chinese. However, a lot of materials are originated from English. So we wanted to do it in the original language, so we didn't water down the materials. So with that said, I'm going to translate that into Chinese just so people understand our plan going forward. So 我们在10月的时候呢，我们将会有一堂专门是讲红蓝卡方面的福利的哈，我们会针对在supplement 跟 HMO 的部分，所以会讲一些福利方面的事情。那今天呢，因为很多的我们的material 都是原文哈，原文是英文，所以我们会用英文来举行。所以我们欢迎就是今天如果说是听得懂英文的朋友们呢，我希望说你们在听完中文的时候呢，也来听下英文的，因为我们是原文从保险公司直接出来的讯息，会比较更为正确。那希望大家都可以参加。那我们来看一下下一个 slide 好 ，Next slide please. Okay, so I want to highlight this page again. If you guys want, you can visit our website. So what you do is you take your camera out and just face your camera to the QR code. You will have a link that comes out that takes you to the website, takes you to our WeChat. The third one is Facebook. The fourth one is YouTube. The last one is Instagram. 所以如果说你今天把电话打开哈，把你的 camera 打开，你就可以直接对着这些 QR code， 你可以把其他的遮住。我们第一个是我们的网站，你可以到我们网站去看。那第二个是我们微信，你可以加我们的微信。第三呢是脸书，第四是 YouTube 哈，第五是 IG、Instagram。所以如果说你想要知道任何我们以后的新的讯息，请您尽快就是来 follow 我们，来就是跟随追踪我们， 在这些不同的频道上和不同的平台上面。So with that said, thank you team for organizing everything. We want to see if we're ready for the raffle next page. If we're not, do we need a few more minutes? So anybody have questions right now? Because we're ready for the raffles. Okay. So I just want to thank you to my team of my trusted employees. Thank you so much for always being, my backstage. So thank you, Danielle. Thank you, Isabella. Thank you. Thank you, Grace. Grace is here. Lonnie, Lillian, and Jesse, Magda. Who else do we have here that I miss? Cindy, Wendy, and everybody that has been helping us with this. This. Okay. So 1 second. Can you wait 1 second? Don't press yet. Okay, who's feeling lucky? Raise your hand. Okay. Okay, so let's start. Okay, Pearl Chung. Oh, there's 2 people? Okay, well, the Pearl Chung and Catherine Wayne both wins. So we have 2 winners, Pearl Chung and Catherine Wayne. Congratulations. That's it, right? We only have two raffles. So that is all for today. Can we confirm how many winners we have today? Okay, so we have 1 more. However, I want to make sure we don't accidentally pick 2 people. Can we double check on that? Maybe you can stop sharing for 1 second and just make sure that we only pick 1 person next time. So sorry about the technical difficulties. We appreciate your attendance, and we want to make sure that we win. Okay, so let's try it again. Okay, so today we're just going to pick out 2 winners because we're having a glitch at this moment. So thank you so much for attending, and congratulations to Catherine and Pearl for winning the raffle. So thank you so much, everybody, and I appreciate your attendance. And we will see you next month on the Medicare seminar webinar. Thank you, and see you guys next time.